Welcome to Reimagining a Public Health System to Build an Equitable Tomorrow. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is co produced with Healthy Places by Design and is the result of the contributions of many in Wisconsin and across the nation, including the Robert Wood Johnson Foundation. I also want to acknowledge that the views of the speakers outside of CHRNR are their own. Hi, my name is Erica Burrows Girardi. I am a senior outreach specialist at County Health Rankings and Roadmaps. Today, I'm joined by colleagues who will assist in your learning experience. Let me start with introducing you to Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hi, everyone. Hello, to everyone in our audience out there. So glad to be here. As Erica mentioned, Healthy Places by Design is a partner organization in co-producing these webinars and the post-webinar discussion group, which you'll hear more about later in today's live session. Today, my role in the webinar will be to monitor the Q&A box. So go ahead and open the Q&A box. And what you want to use that box for is if you have specific questions for our presenters, go ahead and put them in the Q&A box, and I will be keeping a queue or a list of questions, and we'll try to get to as many of your questions as we can during the time that we have for the webinar. Note that if we don't get to your question, it's a great reason to join us for the post-webinar discussion group. Where we'll be able to explore this topic more deeply. But for now, I want to hand it off to my colleague, Tommy Jaime, who will be monitoring the chat box. Hi, Tommy.
Thanks, Joanne, and hi, everyone. I'm excited to be here with you all, and like Joanne said, I'll be chatting with you in the chat box today. And just as a reminder, when chatting, please be sure to use the drop-down box and choose chat to everyone before you send your message. And then this way, everyone can see your chat. And if you have a question, again, please be sure to place it in the Q&A box where Joanne will meet you and hopefully get your question answered. And next up, I'd like to introduce Erin Schulten. Erin's a colleague here at County Health Rankings and Roadmaps, and she'll be helping with technology today. If you have any tech issues during the webinar, please let us know in the chat. Hey, Erin.
Thanks, Tommy. As always, it's great to be here with everyone today. Feel free if you're having any issues with technology, any issues hearing, please put it into the chat and we'll see what we can do to help you. Now I will pass it back to Erica. Thanks.
Thank you so much, Erin, and to all of my colleagues that are helping with the learning experience today. And for those of you who may be new to County Health Rankings and Roadmaps, welcome to our family. And give me a moment to introduce our goal. County Health Rankings and Roadmaps is committed to growing community power to improve health equity. And we ask that you join us in that effort. Therefore, we share data with you so you can identify who isn't thriving in your county. We point you to evidence to share what research is working to improve health equity. We share guidance to help you take steps to action, like actually creating change. And lastly, we offer stories to give you real life inspirational examples of what equitable action looks like. CHRNR is a comprehensive program. Our goal is to provide you with tools and resources to move you from data to action so that in the end, everyone has the opportunity to thrive, no matter their zip code, color of their skin, age, or any other aspect that makes us unique. Tommy's chatting a link right now so you can learn more about who we are and what we do. So I think you would all agree with me when I make this statement that the United States has not been the same since February of 2020, maybe March 2020 for some of you, depending on where you're located in the country. And images like you see here have become our new normal. Most of us on this webinar today know at least one person who has died as a result of COVID-19. Our personal and professional lives were greatly impacted by the pandemic, and we're all suffering from this collective trauma that was created with the pandemic. Equally important is the fact that the pandemic has taught us some really important lessons. Last year, the Columbia Mailman School of Public Health produced a report called 10 Lessons from Our Pandemic. And perhaps the most important lessons in this list are numbers 1 and 10. You see 1 through 9 listed here, and I want you to make sure that you take a look at the slide PDF later on and look at all 10 lessons. Tommy has also already chatted out how you can access the slides. Number 1, the pandemic exposed and worsened underlying inequalities in our healthcare system. Now, the lesson that is most important and the one that we are really want to focus on here is the number 10 lesson, which says that the pandemic showed that a pandemic can happen again. This is why we produced this webinar. We must prepare for an equitable recovery to the pandemic because it can happen again. Now is the time to reimagine the public health system that can address these 10 lessons learned. And that is why we reached out to perhaps one of the public health's most dedicated visionaries, Dr. Georges Benjamin, who's the executive director of the American Public Health Association. And I asked him to share some wisdom with us. I wanted to hear what he said, like what was his idea of ideas related to imagining a public health system, the policies and practices that we would recommend, that he would recommend we change to create an equitable pandemic recovery. Now, in a moment, we're going to hear from Dr. Benjamin. Aaron's going ahead and queuing up a recording that he had for us. And then after we hear this video, we're going to unpack his recommendations with our expert panelists who are joining us today. Thank you, Aaron. Dr. Benjamin, thank you so much for agreeing to sit with me today. County Health Rankings and Roadmaps really appreciates you being here. So thank you so much.
Look, I'm very glad to be here, and thank you for giving me the honor to spend the time with you today.
Trust me, the honor is ours. But you know, we're in a period now where folks have been talking about the need to reimagine public health, like what the role of public health practitioners should be. What are some of the practices we should adopt? What are some of the policies we should consider? Tell me, you know, why is this the right time to reimagine public health?
Well, you know, one of the things I learned during my first half of my career practicing emergency medicine, that a tragic crisis is something you tragically have, but it's something you shouldn't waste. And the COVID-19 pandemic, frankly, has been such a big issue. You know, it's the worst pandemic we've had in over 100 years. It has shown the strengths of public health, but it's also shown, tragically, the weaknesses of public health. And that in mind, now that we know our strengths and weaknesses, we ought to take the opportunity now to reimagine what we would have done differently, what we should do in the future. And that means building a public health system for the future and not just building on what we had in the past. We need to, quite frankly, you know, reimagine the whole thing. And when you've had such a big event, which has been global and in fact has finally crashed our economy tragically, now's the time to really talk about the return on investment in public health. We've got everyone's attention, and you can use that to be moving forward to build a public health system that everyone in every community deserves to have.
And I know that in order to do that, we really need to take a look at policies and practices. So what would you say are 5 policies and practices that we should be considering to create an equitable recovery to the pandemic?
Well, I believe that everyone in public health has to see themselves as the chief health strategist of their community. If you're in governmental public health, you are the entity that has the legal responsibility and authority to be responsible for the health of your community. If you're not in governmental public health, you have the moral and ethical responsibility to be part of that. And so we all need to see ourselves as the chief health strategist. Someone has to be in charge. And when something hurts people or kills people, it's ours. And therefore, we have to step up to the plate and engage other people. And by the way, we can do that in a multi-sectorial way. Sometimes we'll be in charge and take the lead, and sometimes we won't take the lead, but we have to be the architect of our healthy future. The second thing we have to do, of course, is address this issue about the role of government in public health And that means dealing with the issue of politics. And everyone hates the P word. But, you know, Jon Snow did not take that pump handle off that pump without dealing with that political environment. You know, he went to the city leaders and said, I'm going to take this pump handle off. And that means he also had to have the support of some of the religious leaders. If you think about taking off the access to water in a community back then, when the science wasn't clear, that was very much a political act. And we have to we don't want to be politicians, but we have to recognize we work in a political environment. And we're going to have to become much more comfortable with that in terms of the role of government. I think third, we've got to deal with risk communication. We need to become better risk communicators throughout the field. When I was initially practicing public health as a health official, you know, everyone came to me. But now, everyone in the department at every level needs to be a good risk communicator. And that includes all of those armchair epidemiologists that are on TV, on radio, speaking on our behalf. We need to make sure that everyone involved in the public health enterprise are very good risk communicators. I think the third thing is, of course, we have to make sure that we have sustainable funding. The fact of the matter is, public health is a best buy. No question about that. If you don't believe that after 2 years of a pandemic, which crashed the world's economy and has a long tail, then you haven't been awake. And so it's important that people recognize that that 3% we spend on public health is inadequate. And we need to invest not only in enough funding, but sustainable funding so that every community has a public health system that they deserve. And then finally, I think data. We are a data-driven organization. Of course, County Health Rankings is a data-driven document. And so we need to make sure that we get rid of fax machines. Fax machines need to go the way of carbon paper and dinosaurs. We need to have rapid data that's interoperable between the medical care community and ourselves. We need to get that data in a timely manner, in an accurate manner, so that we can make data-driven decisions that will influence what we do very quickly, particularly when we're looking at such a fast-moving health threat as we had with COVID-19. And I think that if you think about this, by putting together that data system and obviously honoring patient confidentiality, we're going to be a much stronger discipline in the future than we were in the past.
So, Dr. Benjamin, again, just thank you for just leading us through a difficult time. You know, the American Public Health Association it just hasn't been easy to be a part of public health these past few years. Let's be honest about it. And so I thank you for your leadership. And with that, I want to ask you, like, what gives you hope in this time?
You know, what gives me hope is the persistence and tenacity of the public health workforce. And even though we have people that have, quite frankly, been driven out of office, they are still persistent, they're still tenacious, and they're still in this, this quest to make sure that everyone in our community has the capacity to be healthy. And, you know, I take my hat off to them. You know, I get to go in front of cameras and speak and meddle behind the scenes. But those folks that are on the front line, I want to thank them and applaud them for their effort. They give me hope, because I know that as long as we have people like them that are in the field, then I'm going to be fine, and my grandkids are going to be fine. And quite frankly, you know, I've got 3 grandkids, and they're my joy. And the fact that I know that I have people in the public health world doing the work that they do, caring about the American people, despite the political backbiting that we're now seeing, gives me hope and gives me joy.
Dr. Benjamin, you know, you were saying that everyone has a role to play in this work. And I know APHA has a new resource to actually help us do that. Will you share that with our audience? Tell us a little bit about it.
So like many people in the world, APHA has a YouTube page, and we've been partnered with YouTube in order to try to explain to people what public health is. And so the first one was about explaining, you know, what is public health? It's going to be one of a series of 20 videos that we are rolling out. I think there are 4 as of this date, but there are ultimately going to be 20 of them. They've been masterminded by one of my folks who's a spokesperson, Mr. Mighty Fine, who's one of my well-trained epidemiologists. And he's one of these folks one of these jewels of an individual that we have in the bowels of the department. He runs our education programs, and he's just an amazing person on this video. When you see it, you'll just see what an amazing public health practitioner he is, because he's such a great communicator. But when you see these videos, they're amazing. And our goal is to make sure that people know what public health is. You know, this is the 150th anniversary of the American Public Health Association, and every month we're putting up a new theme to celebrate it. And we're asking people to join us. You know, obviously become members if you can. Engage us either at the national level, hopefully also your affiliate at the local level, but be part of this quest. You know, be part of the movement, the commons for public health, because we believe that we're strong, we have people's interests. This tragedy that we had with SARS-CoV-2 that caused COVID-19, we understand what we need to do. It is our time. And so, you know, making sure that people know what public health is, that public health is about clean air and safe food and air that we can breathe, and, you know, safety in our homes and in our communities, in our schools where we pray. That's what public health is all about. And if we can continue to do that and make sure people understand that we're the good guys, you know, we're the men and women that are here to make sure that you're healthy and you have the opportunity to be as healthy as you possibly can be. We're not political. We're here to help you. And I think if we can make sure people understand that, then things will be better in the future. And I'm very hopeful through videos like Mr. Fine and his colleagues have put together that we can begin to tell that story.
Well, Dr. Benjamin, thank you so much. We appreciate everything that you do, and I look forward to actually watching those videos as well. So thank you so much.
Thank you. I look forward to working with you for years to come.
Thank you, Erin, for sharing that with us. And, you know, Dr. Benjamin has given us a lot to think about. And we also asked you, what were your thoughts on reimagining a public health system? We asked you to send in questions to submit to our panel in advance, and boy, did you respond. So we've had lots of questions that poured in during the registration process. And so here to help us unpack those recommendations and respond to those questions that you all submitted are our panelists. And I want to start by introducing you to introducing you to Ankit Sanghavi. Ankit is the Executive Director of the Texas Health Institute in Austin, and he's also the co-author of a recent report with the National Network of Public Health Institutes about the future of public health. And we're going to learn more about the report later. So hi, Ankit, and thank you for joining us.
And Erica, again, thank you for the opportunity. Glad to be here and really looking forward to the discussion, and in many ways really inspired with Dr. Benjamin's remarks and really laid out a plan for us.
Exactly. And I started calling you doctor because, you know, Ankit is a dentist. So that's so I like it just popped out of my mouth. But thank you so much, Ankit. And next, please join me in welcoming Nastassia Walsh. Nastassia is the Associate Program Director of Community Health and Justice at the National Association of Counties, or what we call NACO. And NACO is a membership organization that supports county government elected officials. And I especially want to thank Nastassia for joining us because she actually just left a meeting. She's at a conference right now. She left a meeting in which President Joe Biden was speaking. So thank you for seeing us as important to make this stop to spend some time with us, Nastassia.
Thank you so much, Erica. I'm really excited to be here every day, and welcome from the NACO Legislative Conference here in Washington, D.C. NACO is a longtime partner of County Health Rankings and Roadmaps, so honored to be part of the discussion today.
Yeah, I appreciate you. So learn more about our speakers on this webinar's resource page that Tommy chatted a link to before. He's probably chatting another link to it now because I know Tommy. So um, let's start. Let's just, before we dig in, actually, I want to tell you about this because what we're going to talk about today is really just the start of a conversation. I mean, we could talk about, unpack what Dr. Benjamin said for days, right? But I want to invite you to continue the conversation after the webinar. So if you can, please join us for our discussion group where we'll just kind of process what we've been hearing today. And some of you have been in these conversations before. You know that they give you a chance to be face-to-face with other webinar attendees and share what you're doing locally as well as ask questions of other participants. We're pleased to be able to offer these sessions in partnership with Healthy Places by Design. Joanne will be our lead facilitator, and Ankit's planning to join us after the discussion. So, or during that discussion. So watch the chat because Tommy's going to chat out a link later, which will give you the details about how you can connect to the discussion group after the webinar. Now, very quickly, this is just a reminder of what Dr. Benjamin recommended in his brief chat with me earlier. And I want to start unpacking this very first point that he made. Dr. Benjamin reminded us that we all have a role to play in creating healthy communities, and not just any role. We are chief health strategists. So, Ankit, I want to start with you and just kind of lift a question that came from Sherry, who's in East Hartford, Connecticut. Sherry asked us, who is at the table when we reimagine systems?
Great question. And I think just underscores the idea of everyone serving as a chief health strategist. I think in response to your question, Eric, I will take a leaf from one of the work and projects we are involved in here at the Institute is on improving access to the transgender community. And really what I've learned and deeply value is the principle of nothing about us without us. And as we talk about the future public health or building public health systems of the future, I think we cannot imagine, I cannot imagine a system that does not have effective public engagement as a construct. And really, we are talking about individuals, representatives, and organizations that speak to these individuals, especially those who have been disenfranchised, not given their fair chance or equitable chance and opportunity to share their perspectives in lived experiences as we develop policies, programs, interventions for our goal of health and vitality for all. And I kind of underscore with this idea again, with the pandemic in the last couple of years, we have really seen that when we become intentional as a system, we achieve significant progress, especially in the early days of the pandemic. It was mitigating the non-pandemic related needs, whether it was housing, food crisis, economy, or in the last year, it was around vaccination uptake and addressing issues as it relates to vaccine hesitancy, access. They've really stepped up and been a key contributor to public health. But I think we ought to be very intentional as a system to make it more as a part of a formal undertaking and pursuit, because even as I was just reviewing, reminding myself of the 10 essential services of public health and not surprised when I observed that there was no reference to the word engagement or community engagement in any of them, which really speaks to the idea. But I say this with a lot of hope, again, with the idea of what we have seen and observed in the last couple of years, and we really have ways to go. And this in many ways has offered us a template on how we can really operationalize this idea. More and more public health departments have the recognition of advancing health equity, which really speaks to weaving in the community and the community voice. But as we see more Office of Health Equity, Chief Health Equity Officers across the health department, can we also talk in parallel about an Office of Community Engagement or a Community Engagement Officer? I think if every health department in the country can get to that point, I think we are accomplishing a milestone in our pursuit of our public health system for the future.
Yeah, good stuff. Absolutely. Nastassia, what would you add to that? Like, who needs to be at the table?
Yeah, absolutely. I mean, I think you're right. We need to make sure that we have community voices. I want to hear what folks actually need directly from their mouths. So I think that's amazing. I think I would also champion your county elected officials. So, NACO, you said we're an association, we represent the 3,069 counties, 40,000 county elected officials, and 3.6 million county employees, including a lot of the folks on here. I see a lot of county public health directors popping up, which is really exciting. But I think your elected county officials, your commissioners, your supervisors, your executives, your mayors, whatever you all call them in your community, I think should really, really be at the table for these conversations. They are the ones making the policy decisions. They're the ones making the funding decisions. They can be real champions for this work. And so I would definitely make the plug for having your county elected officials at the table as part of these conversations, as partners with the work that you are doing.
Yeah, makes sense. Thank you for that. And Ankit, while we're on this topic of everyone playing this role of chief health strategist, I want to circle back to Dr. Benjamin. I want to explore this point he made that about the faith community and public health. Now, according to a 2021 Pew report about American faith practices, roughly 1 in 4 Americans attend faith-based worship services at least once per week. And I recently watched the interview that you had with an organization called Texas Impact about the faith community's response to the pandemic. So that's what's prompting this question that I have for you. Has there been a missed opportunity to include faith leaders in planning for equity? And if so, how do we rectify that?
I try to think of myself as an optimist. So I wouldn't call it as a missed opportunity, but an area that we can only get better at. But I think it's an important point, and I 100% agree that that faith community are an important asset or resource that we really need to do more in engaging and leveraging what they have to offer. And I could say that for a number of different reasons, but I think for the purposes of this discussion and sake of brevity, I'll try to focus on two factors. One is access, and second is trust, right? Like when you think about access, I work in Texas, and we are a state, very diverse topography, very vast and large topography, where we do have counties as well as cities here in our state with population in the hundreds, and access in general is a generic problem. We are talking about broadband, we are talking about healthcare, we are talking about essential services of public health. But what I know works here in Texas, and reason I engage with groups such as Texas Impact is for this counties, this communities, and as we think about building robust public health system, an effective public health system is when it reaches that last person in queue. So we are talking about reaching this hard to reach populations. Faith communities and our partners in the faith community really have those networks that help us get to those individuals, get to those communities. So when we think about access, when we think about really building a robust public health system, we have an important asset or a resource that we could tap into and leverage. And pandemic has again offered us the opportunity that if we take a step in that direction, they are more than willing to partner with us in this cause. The second, I talk about trust, and really, which has been a term that we have just become familiar and continues to be a challenge as we emerge from the pandemic, is to reinstate public's trust in public health. And as I often say in our work here at the Institute, like trust is not something I would say is a transactional outcome. It's an outcome that's achieved through a transformative, iterative process over a period of time. And it also needs to be bidirectional, supported by the right conduit, which has the trust on the two sides of the aisle, right? And I think, again, faith communities offer us a proven, a tangible resource to be that trusted mediator or intermediary to really not just engage in a process, but really sustain that conversation to get to the point where we have trust reinstated back in public health. And I think, again, that happens to be a significant challenge, and faith community could really be a wonderful resource for us. So
Yeah,
yeah,
I
great.
appreciate that. And I love that. I love how you reframe that this is an opportunity where we can only get better at. So thank you for reframing that. Nastassia, we all heard that Dr. Benjamin said that public health must build our comfort level with working within a political environment. So glad that you are joining us. But increasingly, we're seeing public health be drawn into polarizing, political discussions, and especially with the onset of the pandemic. And I will also add that this topic is really top of mind for many who are on this webinar today. And I know this because the questions were pouring in about managing this tension-filled political environment in which, public health now resides. So in fact, one of our folks that are participating, her name is Andrea, and she's from Indianapolis. She said, how do we start? Where do we start? Like, how can we even build relationships with elected officials? So I think this is the perfect question for you.
Yeah, absolutely. I know this has come up a lot, and I'm not a political consultant, and I would so I'm going to speak sort of on the county commissioner side and how you're engaging with your local elected officials. And I would say your county elected officials are the closest people to you. They might not be the people on the news who you're seeing, but they're the folks who are getting things done on the ground, and probably the ones who are actually most involved in getting things done with what you're doing locally. And our county elected officials have been part of these politically charged environments too, and they are also navigating some pretty strong opinions and things that are happening on the ground. And I think our elected officials have also really been on the front lines. They've been working hand in hand with our public health departments and our nonprofits and our community groups and our faith-based organizations and everybody to support pandemic responses and testing and vaccinations and education and safety, and being a champion for a lot of this work. Like I said, we want our county officials to be at the table. So what does that look like? How do you engage your elected officials, especially the folks who are closest to you on the ground? And so I want to give some ideas and some tips and tricks for engaging with some of your local elected officials. And the thing that I always come back to is early and often. We're all human. Elected officials are human. And nobody likes, to only be approached when you want something, and only be asked for something. And so part of it is, building those relationships early and often, building up trust so that when there is a need, when there is something that you need in the community, when there is a pandemic, when there is an emergency, or when you need something that's a little bit more day-to-day even, they're coming to you for advice. Become their trusted advisor, seek opportunities to really reach out, provide some education, listen to them, hear their perspectives. I know we all have very strong feelings about things, and we have great ideas, and we have great data, we have things to back things up. I think another part of that, and remembering people are human, is to listen, and to learn and to understand different perspectives, and then find ways to have common ground and work with folks. And give us opportunities to be champions too. One of the really tangible things that folks really like is invite us to something. Invite us to one of your events. We love to go to graduations from your programs, ribbon cuttings, opportunities to meet folks who are really benefiting from the work that you're doing, or meet folks who are not benefiting from what I'm doing. And sharing those perspectives as well. We want to see you in action. We want to see how people are being impacted, if that's good or bad. We're going to remember it if you invite us to something. We can be a better champion for you if we experience it firsthand. And I think the other piece is, and I know we're going to hopefully talk about data, because I know Dr. Benjamin brought it up, but data and stories only add credibility to your conversation with folks. Give the elected officials some backup, give us some information we need to make an educated decision, show your impact. How has funding made a difference? How many people have been served? How have we improved outcomes? Or how does this stand to impact your community? If this happens, what's going to happen? And let's really hear from, data is great. Numbers are great. They, I think they always tell a good story, but the other really important part is hearing real stories. I want to hear
that kind of connect the dots.
Yes.
So that the data is more than just a number.
Exactly.
Yeah,
Make it real for me. Tell me about a real person. And I'll just close by sharing. We have a really great campaign at NACO right now called the Untold Stories, and we're asking county leaders to share through videos and written testimonials how the American Rescue Plan Act, which was signed into law in May 2021 and provides direct relief to communities to help with the impact of the COVID-19 pandemic. We want to hear the real stories. Tell me what's really happening in your communities, and you guys can do things like that in your own communities. Have folks come, provide testimony, do short. Everybody knows how to do videos now, whether it's TikTok or whatever the kids are doing these days, right? You can build campaigns like that to share with your local
I love
elected
that.
officials too. So
Yeah.
early and often build those relationships, build that trust so that when it does come time to asking for something, they're going to remember you. They're going to come to you.
Yeah. Yeah. All of us have had children that kind of nag us only when they want something from us. It doesn't feel really good. So I get it. But anyway, having had a career in public health for 2+ decades, something I don't often like to admit, but hey, I've been around a while. But I know that sometimes we kind of hesitate to build relationships with elected officials because we don't want to cross that line into lobbying, right? So can you help us, or at least remind us, like, distinguish the difference between lobbying and advocacy?
Sure, yeah, absolutely. And I think it's pretty short and sweet. I know it sounds complicated on the ground, but I think that the short and easy answer is if you're talking with an elected official on an issue that's important to you, that's advocacy. If you're talking about a particular bill or a resolution, that's going to fall into that lobbying category. So anyone can engage in advocacy, educating policymakers about what you need from your organization, what you need for your department is something anyone can do and should do early and often. Like I said, that's meeting with folks, that's education, that's talking about, tell those stories, talk about impact. Asking elected officials to support or introduce legislation crosses that line. So you can see this definition up here, right? So you can advocate for more testing sites in a particular neighborhood by sharing, how that's going to impact. When you lobby for a particular bill that expands testing sites. So if you're saying, I want you to support bill number 22, whatever, that's going to fall into that other piece. And that includes organizing other people to lobby for or against that as well. So that's when you get into that lobbying area. Now, there seems to be this misconception. So nonprofits can engage in some lobbying without having to register as a lobbyist, but it's a small proportion. There's like strict rules from the IRS about what portion of your budget can go toward lobbying. Federal funds cannot be used for lobbying at all. So I think the big distinction here is if you work for a public health department and you need funding for something, you should talk to your elected officials and advocate on your own behalf. It's very different than saying, I need you to pass this bill if you're going up to the state or something like that. So I hope that's helpful in clarifying that.
That is, and thank you. Nastassia also provided us with a link to these definitions. So absolutely, we appreciate that. Ankit, I'm going to circle back to you for this next. Let's unpack this next recommendation that came from Dr. Benjamin, and that is the need for better risk communication. And I couldn't agree more. Like, many people seem not to be able to assess their own risk appropriately when it came to the COVID-19 virus. There's still a debate on whether or not wearing masks or getting vaccinated is actually helpful. And I know that public health institutes play a role in communicating health information. And, as someone in the public information sharing space, what have been some things you may have observed among public health officials in sharing about the pandemic? And, David from Baltimore asked, how can we pivot to rebuild confidence and trust in public health?
I think, again, a very important question. I really appreciate this. And again, appreciate Dr. Benjamin really lifting it up as a priority and really a call to action for us as a system. And I say that since it continues to remain one of the biggest challenges, again, as I said, like really what pandemic has done is really lifted up the idea and really the outcome of erosion of public trust in public health as a system. And that continues to be a challenge. And risk management communication is an important construct as part of the mitigation measures. But I think I have to echo what Dr. Benjamin shared, like that we are living through one of the worst pandemics in the last century, and characteristics that we can attach to COVID-19 is that it's been a very dynamic pandemic, and still in an early stage, which I'll get to in a minute. So want to offer some grace to all of us in public health, and really those of the public health officials on the front line who have had to be the spokesperson. And pretty much every day it's been in a challenge and a new messaging or a messaging that needs to be reiterated. So I want to kind of say this with some grace. And acknowledging that along with the pandemic, what we have lived through in this last couple of years with the advent of social media in many ways, but also, how far-reaching the consequences of this pandemic has been, that we're also living through an infodemic, if I may say, of information, misinformation, or disinformation. And really a cause, and what I believe is very concerning, which again happens to be something that we need to focus on as we reimagine and build our public health system for the future, is mitigating the issue. It's a very fine and blurred line around the perception and the role of the elected official and their communication and the communication from the public health official, and really making sure that systems and policies are in place that really delineate the roles, responsibilities, and in many ways protect the authority of the public health to, again, allow us to be objective and in a way that where we could be that primary source of messenger of the best available information. And I would just underscore that this is not something that's new. It is fundamental to public health practice. And just as a practitioner, I would always re-emphasize CDC has done a lot of work in this space. They really have many useful resources for us to look to and how to operationalize in practice when we talk about risk communication. And I would, just for the sake of this discussion, I would highlight the 6 principles that pretty much make up the framework. Is be the first source of information, that since that often happens to be treated as a baseline. Be right and accurate, support that with credible information, important to be objective rather than provide a commentary. We need to be empathetic to our audiences and those we are communicating these messages to. Always important to follow up or promote action, like what do we need our audiences to do with this information. And lastly, show respect. Again, this is with this pandemic and the dynamic nature of the pandemic, it's very important for us to again bring in grace into this discussion towards public health, but from public health to the community. And like many others on this call, I look to Dr. Fauci as an effective communicator and really kind of put you on the messages he has to share. And really, again, within this last couple of weeks, he has kind of re-emphasized it more than once, that we are still within the first of the 5 phases of the pandemic. So we are not done with the pandemic, and we have a long way to go. And really, to my reference to the infodemic that we are still navigating, I think we have an opportunity for the remainder of the first phase. Hopefully, we are past that sooner than later. But the remaining 4 phases of the pandemic, we have an opportunity to pursue in practice an infodemic management approach, if I may say. And I know there is a lot that's out there in our field, and efforts are moving in the right direction. But again, it's one of those things that is very concerning to us as a system, and we only need to do more of.
I appreciate that. And boy, is time flying. So I'm looking at the time here, but Nastassia, I want to give you an opportunity to respond to this too, because I know that folks are interested, like how can stakeholders like such as NACO participate with health systems to create an equitable recovery to the pandemic?
Yeah, absolutely. I think I've already, like I've already said, our county elected officials are on the ground. They're supporting this work. I think, I brought up before the American Rescue Plan Act, which was passed in March 2021, is giving $65.1 billion directly to counties to help with these pandemic responses. And it's a pretty historic investment that's going directly to communities. And every county had to submit a plan to the U.S. Treasury on how they're going to spend the money that they're getting. And NACO did an analysis of 200 of these county ARPA plans and showed that 43% of all these county plans of the 200 included investments in some sort of initiative that promoted equity. And this can be everything from expanding vaccine clinics and outreach to underserved communities, hiring equity personnel, wraparound services. I have some county examples, if that's helpful, of places that are doing some work to help really expand community engagement. Contra Costa County, part of their plan was to expand community engagement with mobile vaccine equity teams and community ambassadors, and actually paying folks in the community to help get the word out about public health resources. Collier County in Florida had set aside $2.2 million of these funds to address social determinants through nutrition classes and financial education and mentorship in underserved communities. And where I live here in Montgomery County in Maryland, they're investing millions of dollars each into African-American healthcare programs, Asian American healthcare programs, culturally competent healthcare services for Latinx communities, health and human services hubs across the country. So we have a lot of examples of what this looks like. I think what it really comes down to is that engagement piece. So
I love that.
Engaging with your county officials. And I think our county officials have been doing a really good job of trying to engage their community members to better understand what folks actually need and what they actually want, and particularly in underserved and traditionally underserved communities. So I want to hear from the people about what you actually need. Our county elected officials are great. They're learning a lot about public health, but they are not public health officials, most of them. And so really want to hear about what we need and how to make that work and how to be most beneficial to you all. So happy to share more resources and examples.
Oh, thank you so much. You know, whenever we have conversations like this, time does seem to fly by. But there are two more points that we want to get to that Dr. Benjamin mentioned, and one is ensuring that sustainable funding for public health. So, you know, public health infrastructure dollars continue to shrink. Those of us on the webinar today have probably literally experiencing that now in whatever system they're working in. Ankit, how can we create sustainable funding for public health so we can convince folks like Eliza, who is participating in this webinar? She's a data coordinator in Iowa, and she's asking, how can we retain and support the public health workforce?
So I think I'll underscore, and something that we referenced in the report you referenced earlier for what our team found is, I think for whatever challenges we are talking about, they are not a result of the pandemic. They are directly, we can tie it back to chronic underfunding of public health as a broader system in the country. I think workforce happens to be an important line item in the budget of public health. So I appreciate the question, really, as we also live through the Great Resignation era. Really an important question of workforce. And in terms of sustainability, I think I for the sake of brevity, emphasize on 2 points. One is within when we talk about the workforce within our healthcare and healthcare services, there are many options such as loan forgiveness, loan repayment. I think we need to get to a point where there is a similar resources or support available for the public health workforce, especially for those committing to serving in governmental public health, irrespective whether it's federal, state, local, tribal. Second is, I think this broadly speaks to the idea of sustainable funding and dedicated funding at different levels, starting with the federal administration, but really bringing it down to the states and local governments on how can we have a sustained mechanism to again ensure core funding for the tennis services of public health. And again, this pandemic and resources available through the Rescue Plan Act, but even in the early stages of the pandemic have given enough information that once resources are invested in public health, it does translate into outcomes. So I do think that we have the pandemic has offered us another opportunity. We have experienced it in the past with public health emergencies. Suddenly there is a lot of investment and then it goes away waiting for the next one. So again, it's a systemic problem that will require a solution. Workforce is one part of the story, but fixing that will not result into true sustainability.
Yeah, and I appreciate the fact that you're mentioning the fact that this has been a chronic issue for a while, even before the pandemic. So this is something that it needs to be on everyone's radar screen. But how do we rebuild a sustainable system? And I want to get to this last point that Dr. Benjamin, you guys got me wanting to say Dr. Fauci now, but Dr. Benjamin said about creating better data systems. So I have a question for each of you related to data. And Ankit, I'm going to start with you. We need to have, Dr. Benjamin talked about the need to have data more accessible. He talked about the need to have it, systems talk to each other. You know, I have a really good friend. She's actually my best friend. She's an epidemiologist in a public health system, the largest public health department, and one of the largest, at least, in the Southeast. And she said one of the principal challenges that she dealt with during the pandemic was everyone's need for like real-time data. Everyone wanted like the COVID infection rates, hospitalizations, deaths. And they wanted to provide that real-time data, but the challenge was that sharing real-time data meant that you were sharing preliminary data. So if the data needed to be scrubbed because, you know, maybe the cause of death changed or duplicates or whatever, they felt uncomfortable sharing preliminary data because if it needed to be scrubbed, then and the numbers changed, the public's trust would would continue to erode. So can you share some examples of what communities are doing to overcome challenges with these data issues, particularly that need for wanting real-time data?
So I think, as they say, give credit where it's due. Thanks to the pandemic, I would say we have accelerated into the next gen of public health data and public health data systems and informatics. So since we have really gotten to the point where we are talking real data and data that is reflective of activities of the past week or month, rather than something that was collected a few years ago. And the context change. So I think pandemic has helped us, but really, in many ways, your question speaks to the systemic issue that we face this as a challenge of data standardization. Again, the report that you referenced and we were able to put together really speaks to that. For the public health data systems of the future, and really to address the issues that you talk about from reliability standpoint, reducing ambiguity. We really ought to focus on data standardization across the spectrum. It's not just in data presentation and visualization, but also from the early stages of data collection, organization, analysis, and then getting to the point of data sharing and data translation for different audiences. In many ways, I think communities across the state, especially in this last year, there have been some amazing examples. I'll just refer to a work that we were engaged in, speaking to one of Nastassia constituents, that we were engaged by the local government in USS County 6 months into the pandemic to really look at the COVID-19 story so far and put that into context, that what does this really tell about the community and how can we use this to go back to the community to really communicate what have we learned, but really what are we doing and what we need to do and bring them into.
Yeah.
And we were specifically asked that put this into context of not just the pandemic, but how much of this is also reflective of the realities of this community prior to the pandemic. And
Right.
data dashboard that we can access to, we want you to turn this into something that is accessible to the community, and we need to go back to the community once we have the answers in place. So I think that's an amazing example, and it comes from a local government official, an elected official that really wants to practice that and go back to the community. So it's part of that translation, and which I often say continues to be a challenge, because data should not be our end goal. Data is a fuel for the engine that we call public health. So while we generate new technology and new innovations in data, we should concurrently pursue mechanisms that bring more efficiency in translation of data from where it is to where it needs to be.
I love that, because data is definitely a tool, a powerful tool at that. Nastassia, I want to, the last question that we have in our conversation, I want to toss it to you. I want to know what tools NACO has, and what data tools that they have to help residents and community leaders build an equitable community.
Yeah, absolutely. And thank you for this conversation. So I'll be quick because I know we're sort of running short on time, but we have a fantastic tool on our website called County Explorer. And what County Explorer does, if you go on there, it's ce.naco.org, is there are literally hundreds of data points that you can search. They all come from federal data sources, all of the different agencies with all the different acronyms that you can go in and search, and you can click on your county. So if you're looking for the number of uninsured people in your county, you can go search in the map. It'll show you. It'll also show you your neighbors, so you can click on within your state. So we also include the county health rankings and roadmaps data when that is available. We add that to our County Explorer map. I think what makes the map really helpful is, one, your county elected officials know about it. They can use it. You can download printable maps to show this kind of information, which is a great advocacy tool to just be able to print something or put it on a poster or on a slide when you're doing those education campaigns with your folks. And I think because there's such a diverse wealth of information up on that website too, and it's very accessible, right? We're not like, look at chart table number 32.1, whatever. No, it's like, do you want to know how many uninsured people there are in your county? Click here. So I think it's really accessible. I think it's really easy to understand. And I think the county by county within your state kind of comparisons is really helpful too, as you're doing your advocacy.
I appreciate that. And we will share a link to all of those tools and resources in your resource guide that we're going to share with you tomorrow. You know, Ankit, I was telling you about a report that Ankit wrote about the future of public health. This is a must-read report, folks. I want to make sure that you take time to read this report once we link you to it. Tomorrow, and more wonderful resources coming from NACO. This is related to the COVID pandemic recovery. So make sure you check out www.naco.org/COVID, but we're going to actually include the link in your resource guide as well. Erin, I want to hear from folks in our audience. We want to know if you think you could adapt any of these strategies shared today within your community. Erin's actually going to launch a poll. These strategies include things like talking to your elected officials, talking to faith leaders, making sure that when you use data, you circle back that data to the community, like Ankit said. This is not just for you, this is for you to share with everyone. How about building relationships with your elected officials? Lots of strategies listed here. So please let us know whether or not you think these are amenable to you. And if so, please also share with us in the chat what challenges you think you might have with any of these strategies. We want to hear from you. That's one of the reasons why we offer these polls and ask you to share the information with us in the chat. So go ahead and end that poll for us right now. This is an anonymous poll, so we're not sharing the results, but thank you so much for participating in that poll. And Joanne, I'm actually going to pause for you to ask one question. I am going to do that because I know you got to get to the discussion group. I'm pausing now. Go ahead.
Well, I know that we are running short of time, so I'll just launch in for a question for Nastassia, because I know she's not able to join our post-webinar discussion group. And so Nastassia, you know, some of our attendees today are working in communities where some county officials do not have as strong incentives to engage in public health and equity efforts. So for example, there's no county public health department. What resources or strategies can you give these folks to effectively engage county governments in these kinds of public health and equity issues we've been talking about?
Yeah, absolutely. Thank you for the question on that. I think that's a really important question, because we know, so counties run 1,900 public health departments, but that leaves more than 1,000 counties that don't have their own health departments. And so, you know, how do you impact that? And I think we all know too, and I think there's been some questions going back and forth about this as well, that there's a lot of ways to impact public health if you don't have a public health department. And so I think really getting to know what your county does have authority over. Is it parks? Is it education? Is it small business? Is it agriculture? Is it food? We have folks who have, you know, food policy councils, transportation, housing, justice systems. What are some of the different areas that do touch public health that are within the authority of those county elected officials, and getting to know those, and then reaching out and talking with folks about those different areas. Just because we don't have a public health department doesn't mean we can't do things. Environmental issues, zoning, a lot of these things that fall within that county official authority that I think will really help as you're thinking about reimagining your public health and equity, that these are going to be part of those decisions as well. Obviously, public health cannot do this alone. And so I think engaging in conversations around all of these pieces and the social determinants is going to be helpful on that. So I hope I answered that question.
Yeah, thanks so much, Nastassia. And Erica, I know we've got to close, but I want to encourage folks to come over to the discussion group because there's a lot of questions we just didn't have time for in the webinar. So hope to see many of you there.
All right, Joanne, I'll meet you there soon. I knew this was going to happen because this is such a hot button topic, but Tommy's putting a link in the chat to our evaluation. Please let us know how we did today. We always listen to you, and that's the reason why we actually had this conversation today, because you tell us from your evaluations what you want to talk about. And many of you submitted questions that we simply didn't have time to address in today's webinar, but I have good news. We are getting ready for the 2022 County Health Rankings release. So join us next month as we share important measures and resources that will be released with the 2022 County Health Rankings. And many of those questions that you submitted in advance are actually going to be addressed in that webinar. So we're going to hear from leaders from 3 CHR&R teams working to ensure that you have what you need to make the most of the rankings and taking action. We'll hear from Christine Muganda with data and analytics, Michael Stevenson with evidence and policy, and Beth Silver with communication, outreach, and engagement, which happens to be the team that I serve with. So mark your calendars to join us on March 22nd, and that registration will be available soon. And as we wrap up today's webinar, we want to again invite you to that conversation that we're getting ready to delve into with Joanne and Ankit. And Tommy's actually chatting a link to that discussion group now. So please do join us. And make sure you follow us on social media, folks. We're now on LinkedIn. And also make sure you subscribe to our newsletter, because this is the best way you can find out about our resources and our upcoming webinars. So thanks so much to Dr. Georges Benjamin for spending time with us and recording his recommendations for us. Special thanks to Ankit and Nastassia for sharing their wisdom with us, and for all of you for the work that you do creating equity in your communities. Thank you for all that you do, and see you in the discussion group and next month. Bye.